been asking for your health queries again today so that we can put them to Dr. Bharat Pankhania. I'm glad to say he's here with us now to give us his personal steer as an expert in public health. Hello, are you well?
I am well, thank you.
Good to see you. Let's start with questions about public loos. We had a surprising number about this. Andy asks whether it's wise for his local council to reopen seafront public toilets.
I don't see any reason why not. The point is that wherever we are, whatever we do, in whichever place we are, that we take care not to get infected. And that old advice of, if you have to use the loo, you have to use the loo, but you wash your hands afterwards and you make sure you dry your hands thoroughly. And there is good videos and on YouTube about how you may do this successfully coming out of such places exactly. How you handle the door handle, how you handle the tap, how you dispose of that tissue paper. So go and have a look at it for how to use public lavatories and things. It's a WHO YouTube. It's very good.
OK. Michael Pearce says he's worried about a second wave. Is he right to be?
We are all concerned, and I really wouldn't like us to sort of say we've had a wave and therefore all is well. All is not well just yet. We have quite a lot of background cases out in our community, and with the lifting of the lockdown, we may get more cases, and therefore it is really important, crucially important now, not to drop our guard, because we don't want a second wave, but any of those events going wrong, which is drop our guard, a lot of viruses circulating, with a lot of people circulating, we could create another spike. We need to be cautious. This is very important.
Lots of messages about the schools possibly reopening. One emailer asks, how vulnerable will primary teachers be without any PPE? Well, of course, with lots of young kids, particularly wandering around a classroom, it's going to be very difficult, isn't it?
Very difficult, and we have been debating this issue since Prime Minister Johnson announced that schools were going to open in a limited way. So the Deputy Chief Medical Officer with whom I worked, Jonathan Van Tam, and he said he thinks the risk of children transmitting infection is very low. Myself and many of my colleagues said, we don't know. So our position is we don't know if children are infectious, and we would really like to see the science that the SAGE group of our government uses to come to that conclusion. So in my case, personally, my position is I don't know if children are not infectious, and it is therefore safe for schools to open on a larger scale.
Gary is a first aider in Gloucestershire. He says, can I still administer first aid to a member of the public and keep myself safe? He's especially worried about mouth to mouth. Well, I guess you can't be safe with mouth to mouth.
This is a big issue, and the way I would go is needs must. If you have to, you have to, and this is a needs must. But the situation where you need to do CPR out in the public, in that environment, is very rare. So it is a case of, at that point in time, you would want to decide what to do, because CPR is actually a very rare event.
Here's one about antibody testing. Is there any evidence yet that antibodies give any immunity? This person thinks they might have had it and wants to feel more confident out and about.
David, this is another question and another issue that we are hotly debating, because coronavirus is very peculiar in that we know it is the same family as the common cold, by the way, and we know that it doesn't form good immune memory. So what we are debating, discussing and trying to work out is how long does this immunity last? Is it 3 months, 6 months, forever, etc.? This is another unknown about the COVID-19 coronavirus. And my advice is, even if you test antibody positive, you need to behave in a way that is infection control, infection prevention, and take all those precautions that you did before you got infected. That would be my advice.
Okay. In one or two words, if you don't mind, Doctor, Peter from Bath says, why hasn't more been said about vitamin D? Should we take more of it?
We don't know. That's, again, another item that is hotly being debated and researched. And as soon as we know, we will. But dark-skinned people ought to have their vitamin D levels checked out. And if they are low, take supplements.
OK, nicely done. Thank you so much. Lovely to talk to you. And your garden is looking fantastic. Thank you.
Thank you, David.
Well, from the doctor's garden to